So I'm Harriet, I am the LSC for South Yorkshire in MESMAC, and we're doing a HIV Testing Week panel to discuss HIV, stigma and lots of other related topics.
Hi everybody, my name's John Dugdale and I'm the Community Development Worker focusing on sexual health within Bradford MESMAC.
I am Kemi I'm a Community Development Worker with MESMAC Leads. And I focus on sexual health and PrEP.
And I'm Craig. I work in Hull, community development worker, focusing on sexual health for queer communities.
John, what is HIV Testing Week all about and why do we have it?
National HIV Testing Week is an annual campaign that similar agencies all around the UK kind of come together to amplify a national message about encouraging people to get regular testing for HIV, showing how easy it is to do it, how easy it is to access it. And this year's tagline is simply I test. So it's, we do this work all year round, but, we take this week to every year to amplify the message of how important it is to get tested for HIV.
And why is it, do you think, that HIV Testing Week is important in regards to testing in general? Do you think it helps? Do you think it sort of encourages other people to do it?
Some of the work that we do all year that perhaps just kind of runs just under the radar, it sort of brings it to the fore. And, in the absence of any national kind of public health campaigns, this, I think, sort of amplifies the message. And we come together with organisations all across the UK to promote how important it is, just to, to reinvigorate in people's minds how easy and important HIV testing is.
Kemi, you said you do quite a bit of work within HIV and HIV support. What do you think are sort of the biggest misconceptions that we still have around HIV?
The perception that you have to feel unwell before you can tell yourself that, oh, this might be HIV. I guess that's one of them. And also it's also the notion that after diagnosis that, your life begins to have a downward trend or go the downward trajectory. So I think that's one of the things we're having to correct. For example, for people to come for testing, one of the things we see in the community is, but I don't feel sick. I have been so well. I haven't been to the hospital in 2 years, and they think that, I have to feel unwell before I go for testing, before I suspect I might have HIV. And then after testing, for those who test, one of the questions also for everyone is, okay, what if I test positive? Does that mean my life will go down? So things can never be the same again. I begin to feel really sick. My mental health goes down. I lose my job. We still have that notion, and which we are strongly still correcting to let people know that testing positive for HIV isn't the end of life. You still have your life to live and enjoy because the treatment is effective and people living with HIV are doing excellently well once they are on effective treatment and with the support we give to such persons.
With a lot of the people that I speak to, some of the big worries about HIV that it might be the end of their sex life, which is absolutely not the case. Once somebody's on effective treatment, we call it undetectable equals untransmittable, U equals U, means that they're no longer able to pass on the virus. It also means that because somebody isn't able to pass on the virus because they're on effective treatment, they don't have to disclose to all of their partners that they have HIV because there isn't any risk there of it being passed on. People can still have children and not have to worry about their children being born HIV positive. And often disclosure is that big thing that people are worried about, because once you make that disclosure, the cat's out of the bag, it can't be put back in. And one of the things I often talk to people about is, if you do want to disclose to somebody, just make sure it's somebody that you can trust first off and that they're not going to go and tell other people.
If you had to give advice to sort of partners or friends or family when it comes to talking about HIV testing in a healthy, non-judgmental way, especially, for example, if someone has just told you that they're living with HIV, how would you recommend that they deal with that, or is there any support for them?
So I think specifically for the partners of HIV positive people, we would have a chat with them, would answer any questions that they might have, because for some people, they'll have a lot of questions if their partner tells them they have HIV, but because they love their partner, because they care about their partner, they might hold back on some of those questions because they don't want to upset them, they don't want to offend them, they don't want things to be taken the wrong way. So we can give them all of that information, make sure they're reassured, and it's not something that's going to potentially offend or upset their partner. And when it comes to the partner making the disclosure as well, we can help support them through that. We can talk them through ways that they can broach the conversation with their partner and make sure that we're there throughout the process as well for if they do have a negative outcome of that we can make sure they're getting the right support.
Can you explain what PrEP is and how it can prevent HIV transmission?
We shorten it to say PrEP. It's easier to say PrEP, but it means pre-exposure prophylaxis, and it is a medication that HIV negative people take to prevent them from getting HIV before possible exposure, if that makes sense. So it is a pre means before exposure prophylaxis, meaning before exposure prevention. I guess that is one of the major ways that we want to prevent HIV, and we want to end new cases of HIV by the year 2030, meeting the global target. And what we are doing currently is to educate the community, increase awareness among various communities, high-risk communities or the general population about how effective PrEP is, because it has been proven to work. Yeah. It's a very strong preventative measure to HIV. One of the communities I work with are the Black African communities and other marginalized communities. The approach we have used is to explore culturally appropriate ways to pass this information across. We dispel myths and misconceptions, and of course there are a lot of myths and misconceptions about PrEP. One of it is that, if I take PrEP, it will just encourage me to be more promiscuous. I hear that a lot. and part of what we're doing is to address the concerns of people around PrEP and encourage them to take PrEP as a preventative measure so that they don't get HIV.
Do you think that how other people view you if you're on PrEP, do you think there is an issue there? Like if someone knows you're on PrEP, do they think that you are more promiscuous, and is that a barrier?
Yes, in the communities I go to, that's one of the things. People think, if they find the PrEP tub, the tablet with me, it means that, I'm up and about, I'm just doing stuff. And, so what we do is to educate them about, I guess it's about weighing the risk and the benefits for them, and also to encourage them or to educate them on ways. There are different ways. You don't have to tell everybody that you are on PrEP if you think that might be an issue for them. So it's not to dispel their concerns, but also to look at ways where we can together discuss ways in which they can address those concerns if those are big issues for them. Yeah, and how does PrEP work? It works by building a barrier. It builds like a kind of when you take it before exposure, it protects the body by like building a barrier, such that if HIV comes in, HIV is not able to establish an infection.
You do a lot of work supporting people to access sexual health who are involved in chemsex. For people who might not be familiar, would you mind defining what chemsex is in a sexual health context, and then also how PrEP links in with that as well?
Yeah, so chemsex is when particular drugs such as GHB, crystal meth and methadone are used to enhance the sex that people are having. Quite often it takes part in group sex scenarios, but can also be just between two people. The drugs that are used are for making people hornier, for making people able to have sex for a lot longer. And the reason why talking about PrEP and HIV testing is so important when it comes to chemsex communities is because within chemsex scenarios, STIs can absolutely thrive and HIV can absolutely thrive. Often people engaging in chemsex are in quite small inner communities. So if they're picking up an STI from outside of their chemsex circle, they're bringing that into the chemsex circle, and it can very quickly spread through those circles. So being on PrEP is absolutely something that's really important. People can go into chemsex scenarios thinking about using condoms, but once you're under the influence of drugs, one of the effects the drugs do have is that they get rid of all your inhibitions. You're a lot more relaxed. You're not really worried about things as much. So you might be thinking I'll use condoms when you go to a chemsex party, but then once you're under the influence of drugs, you might forget, or you're just no longer worried about picking up an STI, contracting HIV. So being on PrEP means that you've got that protection there, regardless of whether condoms are used or not.
So as someone who works in sexual health, has worked in sexual health in different areas, not just Yorkshire, how do you think it has changed in relevance to treatment, testing, stigma, those sort of things?
It has changed a lot. You know, in my personal experience, I've worked within sexual health now for about 12, 13 years, predominantly in London, and then obviously recently moving back to MESMAC. What I can say is that, you know, this is not a London-centric thing, it's a UK-wide thing. You know, I gave an analogy recently, you know, as someone of a certain age, you know, I'm over 50, I remember, you know, the advent of, you know, when the AIDS kind of pandemic started back in the, you know, the mid to late 80s, there was this huge, horrendous kind of campaign that was called AIDS Don't Die of Ignorance. And, you know, for a gay lad, 15, coming to terms with his sexuality, what that said to me was, if I have sex with a man, I'm going to die, basically. That was the message that came across. And, you know, it was horrendous, the kind of stigma, and it just fueled that stigma. And we haven't really got over that. I don't think since then there's been anything to counteract. Fast forward, you know, like 20, 30 years, you know, getting tested is so easy compared to what it was like. I mean, I remember having to have my first AIDS test, as they called it. This was to get an insurance cover for a mortgage, and until I had that, they weren't going to give me a mortgage. And I had to go to a clinic in York. There was no pre-discussion. I had to pay for the privilege of it. I had to wait 6 weeks for the results, and then that was it. Just, you know, so, and it was very much this stigmatized, you know, and there was no kind of, oh, you're going to get this for other reasons. It was basically, you're going to get this because you're a gay man, you've been having sex, obviously you're going to die, sort of thing. You know, fast forward now, and, you know, on a daily basis, like yourself and Craig and Kemi, you know, we do testing and we're giving people, you know, results that come back in like, you know, 20 minutes. It's so easy to do. It's a finger prick test. You know, often we're doing it in locations that aren't clinical settings, so they're not as perhaps kind of worrying for people to be seen in places. You know, our offices are very discreet. I think the big thing I think around it is still the stigma that comes with HIV and those words. They don't realize the whole U equals U message. They don't understand that, you know, once you're on treatment and you become undetectable, life very much carries on as normal. And, you know, we know, I know people, we probably all do know people who have been on kind of medication for well over 20, 30 years now and living as normal a life as anybody who's not HIV positive.
Kemi, with what we were just talking about different communities, I know you do a lot of work with women. Do you sort of experience the same thing in Leeds and Bradford as we do in Rotherham, that there's a lot of stigma towards women coming into sexual health, and how do you deal with that?
I mean, either testing or even coming into the building for anything sexual health, and the approach we've used over time, I mean, the approach that we use in the communities when we go for community outreaches is trying to normalize speaking about sexual health without shame. I mean, I conduct sessions like workshop sessions or awareness sessions with women group, and although it takes time to get to the point where you're able to freely talk about sexual health and anything relating to sex, but once we get to that point where they are comfortable to listen to you, what we're trying to do is to make it okay. I mean, normalize speaking about it. And what we also do in sessions, part of the workshop, is that whilst we're speaking about routine tests, yes, it's good you go for mammo if you're of age, you go for cervical screening. Can you also go for sexual health screening too? So that's one of the ways we've encouraged them to, yes, you need to go for this screening. Some of this screening you might not be able to get at the GPs, and these are the places where you can get such screenings. Is also to assure them of, some of them, the fear is, yes, there's still that mistrust, and there is that feeling of being judged to, oh, she's coming in here, she's, all of this and that. So I mean, what we try to do is to give them some comfort and encourage them about speak with them about confidentiality, about the benefits of doing such tests, and for them to also incorporate it into their self-care routine, to say, yes, you go to do your nails, you go extra miles to get this done. Can you take another step to do your sexual health screening at such and such place? And sometimes it takes time too. So what we do is to take to the communities, but also after some time we encourage them, can you come over? Yeah. So in certain communities, I have done the first, the second, going to the communities to do the testing, and then by the third, I'm like, I love to see your face in my office. Yeah. Can you come over? Yes. So I guess it might take time, but I think it's improved over time. I think it's improved. We see more women knocking on the doors to ask for sexual health. It could be inquiries or, get tested.
So how can healthcare providers create the safe, non-judgmental testing spaces or support spaces, do you think?
So I think making sure that you understand the communities that you're working with is really important. We've talked a bit about chemsex. I think chemsex is a really good example of a community that needs a lot of understanding when it comes to accessing services. I think a lot of people, when they go to especially clinical services, feel a little bit of potential judgment from staff, whether that's because the staff have said something wrong or whether that's just because, that person's got that perception themselves of a clinical healthcare worker. Making sure you're understanding the issues, making sure that if somebody tells you something that might be quite shocking for you, that you don't show that on your face, because if you do, that's just straight away going to shut down that conversation. It's going to make that person feel like you're judging them, and being just really allowing for an open conversation with people, making sure you're comfortable talking about sex, making sure you're comfortable talking about kinks and fetishes and all the different types of sex that people have, and make sure you're not making that person feel like they're weird or there's something wrong with them for the sex that they're having. We used to have the tagline on some of our t-shirts at MESMAC a few years ago, which said the best sex with the least harm. And I think that's very much at the heart of the work that we do at MESMAC, and what a lot more community organisations are really good at working with is, we want you to be able to have the best sex you can have. We want you to go and enjoy the sex that you enjoy. We're just here to give you some advice and some information on how to do that safer and what prevention methods can be used to reduce your risk of getting HIV or other STIs.
So if someone was, for example, not in sexual health, or maybe they were like a drug and alcohol worker, or a housing worker, and someone mentioned something to them, or they wanted to talk about sexual health, what would you recommend that staff do? If they had no knowledge of it, what would your best advice be?
If they had no knowledge of it, I'd say the best advice is to refer that person to MESMAC or to your local sexual health service. I think certainly working in community work, staff generally, we all want to do our best for the person that's in front of us. We want to be able to help them. We know that people find it really difficult going to different services that they aren't aware of or haven't seen before. But we've also got to accept that we all have limitations in our area of expertise, and we're not letting that person down by saying, we don't understand this, but here's these people that do. We're actually helping those people. And you can take your service user over to the sexual health service setting of MESMAC. We quite often get it where we have professionals bringing people to us. They're bridging that gap between their service user who's never accessed our service before, making them feel a bit more comfortable by bringing them. And then as well, we can deliver training to organisations on sexual health and various different topics like LGBT awareness, trans awareness. So come and speak to us, look at getting some training if you want to upskill your knowledge as well.
We're seeing more stories about people living with HIV. We are seeing a bit more coverage. We're seeing things being talked about a bit more openly on our TV screens and online. What do you think about the on-screen representation versus in real life with the sort of literature that's out there, past and present?
I think, again, past, I think one of the most iconic films that, people might know about was Philadelphia, which was Tom Hanks, who plays a lawyer who developed AIDS, and that the case that followed. I think, that was and again, that was something that I sort of resonated with at that time. And it sort of, I think we went through a period of where there was nothing, we got stopped by a gay kiss on EastEnders, it was something that was represented on Channel 4 late at night, Queer as Folk came out and it blew people's minds kind of thing, Whereas I think fast forward, especially, in that intervening period, people have got access, and sometimes quite badly, people have got access to more information. So, Google came on board, social media's come on board. There's a lot of misinformation, I think, out there. We have to be very careful what is good information, what is bad information. Probably like yourselves, I get people come in to me and they're going, oh my God, I've got XYZ, I Googled it last night, and so on and so forth. And you just get to the point where you go, okay, let's forget that. Let's have a conversation, talk to an expert, and we'll sort it out. Kind of going back to your original question, I think, recently, and it's not something I personally watched, but I did see online that, obviously I think it was EastEnders in a storyline that featured, somebody having to address with friends or family or whatever that they had been diagnosed as HIV positive, and they kind of took the storyline about how they'd got to a certain point where they'd been sort of given that kind of undetectable status, and almost then kind of showed that it was almost just like an everyday occurrence, which it should be. People I don't have to give it. Some people who are diabetic don't give their daily kind of blood count for their diabetes check. So why should, I think, until more things like this just become the norm, I think, it can only be a good thing. I think perhaps there isn't enough representation and we could do better at it on mainstream. But I certainly think there is, I know of lots of, people, different content creators on, different platforms that do talk about their daily kind of life with HIV, and how for many people it's literally one tablet a day, and maybe in the future we're going to be moving to injectable, so that's going to be different, and hopefully a cure.
John, what advice do you have for someone who's nervous about asking a provider for PrEP or a HIV test?
I think it's something that that Craig touched on about, as professionals working in sexual health, we're very comfortable talking about sex. And we talk about it in a language that isn't sort of clinical. We talk about it on a level playing field, and kind of making people feel comfortable and kind of heard, that we know what we're talking about, we understand what they're going through. And the fact that, from our personal experiences, we've probably been through similar things. And it's about, encouraging people to kind of educate themselves, be understanding, kind of ask questions. Like no question is there's no question is a stupid question, I always say. And kind of, I think some of the USPs about what we do at MESMAC and the locations that we work out of, it provides that anonymity, the confidentiality. I think that's something we haven't touched on, that a lot of people think that by giving us information, it's going to be shared with their doctors, their hospitals, and and so part of that is you can almost see sometimes the kind of relief when basically they can, they don't have to give all that much information.
How, as an individual, can we reduce stigma around HIV? So we've talked about other people, we've talked about health services, but if you're just, any person, how could you personally reduce stigma around HIV? What could you do?
I think the way the general population or everybody can support stigma reduction around HIV is to get information, like read, ask questions about this HIV, because I guess one of the major issues we have are still around the misconceptions people have had and people not wanting to learn. They're just set in their ways and, just have stuck to the knowledge or whatever the understanding of HIV, everything around HIV that they've always carried. So what I will say to such people is grab as much information as you can. On our website, we've got different resources that can support you, that tells you about the various things going on now, including effective treatments, including PrEP. U equals U, which says that undetectable means you can't transmit the virus. And there are a lot out there about testimonials of people living with HIV and living so well and doing well as people living with HIV. So what I'll tell everybody who is not living with HIV or who is not a healthcare provider is to give people, everybody that needs support, to give them the support to go do a test. What do I tell people wherever I go to, in churches, in the different communities, is to encourage people, do not be a judge. Reduce judgmental, stuff, is to increase their awareness, dispel myths and misconceptions.
We do get a lot of people that will say things like, "Oh, I don't think I need to test for that because I'm not a gay man." Is that sort of something that you come across in your area, and how do you sort of combat that myth?
It absolutely is. I'll have people say to me, "Oh, I'm not gay, I'm not at risk of HIV," or they'll just come in for a chlamydia test and be like, "Oh no, I don't need a HIV test." And it's like, well, anybody can get HIV. If you're having sex, you can get HIV. If you've been at risk of chlamydia, you've been at risk of HIV as well. Anybody who is having condomless anal or vaginal sex is at risk of HIV, so they need to get tested. But I think it goes back to that issue where we were talking about representation before, where often the only community that is represented in media and in storylines on soaps and things is often gay men rather than heterosexual people. And what we've seen over the last few years is actually in the new diagnosis of HIV that we're getting, it's more heterosexual people that are being newly diagnosed with HIV than it is gay men being diagnosed with HIV. Gay men generally engage with sexual health services really well, understand things like PrEP a lot better, and a lot more gay men are taking PrEP than what heterosexual people are. So yeah, just because you're straight doesn't mean you can't get HIV, and at the minute there's more straight people getting HIV than there is gay people.
Craig, how would someone get a test for HIV if they wanted to get one in testing week and beyond?
So if somebody wants to
Yeah.
get an HIV test, they can give us a ring at one of our offices. They can pop onto our website and book in for a test through our website. If you're in an area that doesn't have a MESMAC, then just Google sexual health clinic in your area and it'll come up. There's a little NHS finder that you can use as well. Really easy, really simple. The test that we do at MESMAC is an instant test, so you'll get the results straight away as well. If you're in a clinic, it might be that you have to wait a week for your results. And important to remember, HIV testing is free as well. So one thing we do sometimes see during testing week is you'll get private companies advertising their HIV test that are super expensive. Don't go paying for an HIV test. It's completely free in the UK.